Hi everyone, it's a concerned Dr. Miskoff and it's May 9th, 2020, about 9:30 p.m. And I wanted to go over a little bit about children pediatrics. There's been some questions about that and stuff in the press. Really with novel coronavirus or COVID-19, the kids were doing very well and pretty much asymptomatic or having no problems until recently. There's being more local reports in the New York City area of 15 kids that were on ventilators the other night, and now 3 have passed away with a what they're calling mysterious illness, or more specifically, kind of like a Kawasaki vasculitis syndrome, which is very rare typically. Kawasaki disease, you see less than 20,000 cases in the U.S. per year. Usually goes through different phases. In phase 1, they get a rash in the chest area down to the leg area, or in the groin. You can see it, and as they progress into phase 2, that starts to peel. These kids get involved in a mucous membrane sometimes, lymph nodes specifically in the necks, kind of like a mono type thing. But most recover and most do very well. So they're seeing this type of a very similar syndrome in kids who either tested positive for corona or the antibodies. Typically, Kawasaki is thought to be linked to genes or viruses or bacteria. In this case, the virus would be the COVID-19. It's typically seen in those less than age 5, and I think the 3 that passed were under 10. More common in boys, about 1.5 times. Asian is the most common descent, hence Kawasaki, and strawberry tongue is the old board question, which is connected to this. They can get a strawberry-looking tongue. If they progress on to phase 2, they can have joint pain and aches, abdominal discomfort, some diarrhea and vomiting, again, the peeling of the skin. Cardiac manifestations is also often listed with vasculitides. In this one, it's reported most commonly in the 10-day to 2-week zone, although it could be delayed. And what was delayed, also described with this, was that kids who they felt were infected maybe 4 or 6 weeks, even a little bit longer prior to actually getting the Kawasaki. So most of these kids are asymptomatic, and then all of a sudden, 1 to 2 months later, getting the rash and the fever and this type of syndrome. Again, it has been reported throughout the world, about 85 cases in the U.S., most over 70 of those in the New York City area. If you have any questions about this or concerns, there were reports of adolescent boys getting some rashes near the toe area. Reach out to your primary care pediatrician. There's also telemedicine services widely available now. Most of the hospital systems are advertising for it and doing it, and most private practices are also, dermatology is doing it. So you can get on with a specialist or a primary care now very easily. Even urgent cares are doing telemedicine. So anybody getting a fever is a person of interest. I'd be concerned, especially if they don't have a medical history prior to that. Anybody getting a new rash, I'd be somewhat concerned. Of course, it is allergy seasons, and we talked about that last night, how with the tree pollen counts up, even some of the hives and rashes we're seeing come out during allergy season. So, most of the time it's not going to be COVID-19, but if you have a question, easy enough access. So everybody stay well. If I hear anything more about kids in COVID-19, I'll try and keep you guys updated. And again, have a great night.